Hi, in this video we would like to come back to the topic of ectopic pregnancies with a diagram to better explain what exactly is happening. So we've explained in our previous video that ectopic pregnancies are pregnancies that implant in the wrong place. So as you can see the diagram here, the green area here is the endometrium inside the uterine cavity. This is where we want the implantation to happen. And this is where it commonly happens. This is where you can get all the nutrients, the space, the blood flow from the mother to help it grow healthily and naturally. But for ectopic pregnancies, implantations happen in very different places. So as we can see here, fertilization occurs in the fallopian tube, but it can also cause implantation in the fallopian tube. We will talk about this later. So these types of ectopic pregnancies are known as tubal pregnancies, which are the most common types of ectopic pregnancies. Usually they will have this entire fallopian tube removed and terminate the pregnancy. This is conventional treatment. It can also implant on the roof of the uterus where there's very poor blood flow, leading to an early miscarriage. It can also implant in the cervical neck. It can also implant outside the uterus, inside in the pelvic cavity. These are all documented, although very rare. But you can see the picture here that it's implanted in the wrong places, causing potential complications. So in this diagram here, we'd like to talk about tubal pregnancy because it is the most common one. Up to 90% are diagnosed as tubal pregnancies, and it is considered a medical emergency. So when a zygote is fertilized in the fallopian tube, it will travel along the fallopian tube. These pink drawings are actually what we call cilia, which will actually help move the zygote towards the uterine cavity, the endometrium. But in tubal pregnancies, the pregnancy will implant right inside the fallopian tube. Now, why is it a medical emergency? Is because this pregnancy will grow. It will keep growing until it causes a potential tubal rupture, which will cause massive internal bleeding and then also potentially threaten the mother's life. So what we do here is that most conventional treatment is that they would inject some medication to terminate the pregnancy and then remove the fallopian tube. This is how they protect the mother's life. Now here at the hospital, we have a way to preserve this pregnancy under specific conditions where we conduct a keyhole surgery right here at the point of pregnancy using 3D laparoscopy to carefully remove it out of the fallopian tube and then place it into the endometrium. We also do not need to remove this fallopian tube. All we need to do is that we need to stitch up the opening and place a stent here to promote healing and also avoid any potential effusions. So I hope you learned more information about this ectopic pregnancy with our diagrams drawn like this. And if you'd like more information, more questions, please leave them down in the comments below. Also visit our website.